How do you know when progress has been made in therapy?
There are several different ways you can answer that. I always tell my patients that a really good sign that therapy is working is when they don't want to come anymore. Now, that doesn't mean that if I'm doing a terrible job and they don't want to come, I turn that around and rationalize and say, no, therapy's working. That's not what it means. What it means is that if a client is starting to feel uncomfortable, if it's not just a chat session, but they're really feeling that, that maybe scary topics are being broached maybe, then it means that we're starting to dig in the right places. Because a lot of clients, they believe that they know what their issues are and they've talked about it before with other people and they want to deal with it in therapy. But historically, maybe they weren't taking the right perspective. Maybe they were missing things. Maybe they weren't being asked the right questions. So a good therapist is able to bring things to the table that your friends can't, or your own self-reflection might not. So when you're doing that, and you're really coming close to that which you've been avoiding for so many years, or that you've been trying to push aside, or that you've twisted into some fantasy, it can be very uncomfortable and the client will not want to come to the therapy. So I let clients know it's very normal. They have to be aware of it, they should be attuned to it, and they should know that this is a good sign that we're really coming close to the most serious issues. And I also tell them in a similar manner that things get worse before they get better. Same idea. Before you can actually have improvement, you have to be able to acknowledge and then confront that which you've been avoiding or that which has been causing the most pain, and you probably don't want to have to deal with head on.